Hi, everybody. The question that we are here to talk about today is, does the healthcare system fail consumers and caregivers and aging adults? I'm Pamela D Wilson. My website is PamelaDWilson.com. So many caregivers that I talk to today, and even older adults, say that they struggle to get the care that they want from the healthcare system. And many don't understand why doctors don't take their concerns seriously or why they really can't get the care that they want. I want to share some insights about this and also offer some solutions. It's true. The healthcare system doesn't speak the same language as consumers because the healthcare system is filled with educated doctors who think from a clinical perspective instead of how to really talk to and communicate with the healthcare consumer. Caregivers that I know will take loved ones to doctor appointments, and it seems like the doctors and the people in the office really don't want to know what the caregivers think or what the caregivers are doing, when honestly, if it wasn't for that caregiver, an aging parent or a spouse wouldn't be able to stay at home. If it wasn't for their help, they wouldn't be able to stay at home. The caregivers know more about the health of the people that they care for, sometimes more than that person can even communicate, because going to a doctor's office can be stressful. Can be a stressful experience. And when consumers don't feel that doctors or the healthcare system or insurance companies or Medicare or Medicaid care, they don't participate. So the way that we as caregivers and aging adults and healthcare consumers, if we could even be called that, can help ourselves is to take an interest in learning about health. And this can be challenging because people will say to me, well, Pamela, I don't know what I don't know. I don't know what I should know. I don't know what I should be learning to have a better relationship with my doctor or feel like I at least have a partnership where I'm getting some of what I want. There's a lot of suspicion out there today. A lot of caregivers tell me they don't trust the government, they don't trust insurance companies, they don't trust the healthcare system. I get that. Because when I was a care manager for my client, I can honestly say that it was a daily battle for me and my staff to try to get people in doctor's offices or in clinics to help us because we didn't really feel like we were working toward the same goal. And that is the problem. The healthcare system has a lot of constraints and things that they can do and they can't do because of insurance, but nobody explains this in simple terms so that the consumer can understand. Now, taking this back to a very simple example, if you look at your family situation, if you are a caregiver and you're caring for a parent, are your grandparents still alive? What information could you gather if you actually sat down and had a serious conversation with your parents or your grandparents or your spouse and say, what are the health issues that are affecting you today and how does it make you feel? How have your abilities and your opinions and your mindset and your mood changed because of this health condition? And what are you worried about? If we as the caregiver can have a better insight of what happens to people that we're caring for, and even people that we know, we can learn to communicate better to the healthcare system. But there's a side benefit. That side benefit is that we as that caregiver can learn from that information if we can gain what is called health literacy. Health literacy has some basic skills like reading and writing that most people can do. But it also involves using judgment and decision making based on our past experiences. But in healthcare, the problem is many of us don't have past experiences. This is why I advocate for caregivers and speak about the importance of education and knowledge to support you in caring for parents, grandparents, spouses, and yourself. There's a lot of information on my website, and I work with a lot of people in the healthcare system to seek to find ways to communicate complicated healthcare information to caregivers so that it makes a difference. Many of the reasons that elderly parents leave home are health related, and I'll share a simple example to illustrate the idea of how a healthcare provider could talk to caregivers but really doesn't. Let's say that your elderly parent had a fall. There are a lot of reasons that elderly parents fall. They can fall from medication issues, from dehydration, from physical weakness, from a chronic disease, and also from being physically weak. So as a caregiver, that puts a lot of work on you to figure out what the problem is, because in a 15-minute doctor appointment, you can't always figure it out. And honestly, you know more about your parent than the doctors do. The doctors have very limited information. They only can make decisions based on the information that your parent gives them, or a spouse, or you. So in a sense, you have to become this information collector of what's important, what's not important, what should I worry about, how do I know what I should be looking for. In a sense, to get good health care from the healthcare system, we as consumers have to become advocates, and we have to become a little more educated about the healthcare system, because doctors and nurses, they speak in very different language. They speak in medical terms. There's this term out there called healthcare consumerism, which really only means something to the healthcare system. It doesn't mean anything to consumers, because let's face it, healthcare is not a consumer market. It's not like consumers have an effect on the services offered or the price of goods. That's all set by the government and healthcare insurance companies. We don't have any control over that, which is why, honestly, consumers and caregivers and aging adults are so frustrated. It's why many people just give up and don't even go to the doctor or get health care. But the downside is that has long-term effects. Delayed care, postponed medical appointments, only results in a higher chance of having chronic disease and being sicker and needing more care when we're older. So what is the solution to all of this? The solution is really for caregivers and consumers and older adults to take more charge of our health, because the healthcare system isn't going to do it for us. They have a lot of information out there, but they don't know how to explain it to us. They don't know how to talk to us. There's a lot of information on my website where I explain a lot of these concerns in simple terms. My podcast every week comes from suggestions and questions from caregivers, and I take technical information and distill it down to something that actually makes sense to you, something that you can actually learn and use. There are also caregiving courses on my website that you can take if you want to learn how to help elderly parents stay at home and really what it takes. The information in the course is based on my 20 years, my personal experience of one-to-one in helping caregivers and aging adults and my clients stay at home and be healthy, because of the knowledge I gained in interacting with the healthcare system and learning about healthcare issues that I translated into simple, everyday activities that everyone can use. So the question of how to get help from the healthcare system, how to get better care, it's to learn and to embrace knowledge and wisdom yourself so that you can be a better caregiver and a better healthcare consumer. I'm Pamela D Wilson. Please share this video with others you know who are struggling with the healthcare system, people who maybe have given up trying to get healthcare because they don't trust doctors or they've been mistreated. There is a lot of help, hope, and support on my website. Thanks for watching this video. I will see you again soon in another video.